body shame and all kinds of things that we deal with as
Mhm.
women. So it's
Yeah,
it's a passion for me in that way.
that's
And so
great.
and then I was like, well, this would be such a fun thing to do. And I'm just going to, my idea was to do it like a summit, but it's sometimes a little, there's a lot to it. So, but I feel like it's, the feedback is going extremely well. People are loving it. So I'm excited to share. And I'm excited to give people more options because I think we're live now. Yay. There's so much fear around breast cancer, but really I feel like there's so much we can do proactively, like you say, to keep ourselves healthy, our breasts and beyond.
Yeah.
And for everyone watching, hello. And April, I'm so thrilled to have you here today. So I would love if you would just share a little bit for everyone watching. We're going to really dive in more to thermography and also proactive and preventative measures around breast health. And this is something I'm really excited to learn about because I know for me personally, I get a yearly mammogram because I have dense breast tissue and there's usually something they want to look at again through ultrasound or whatever, but I know I don't always want to have to get the exposure to the mammogram so often. So I'm really looking forward to learning more about thermography for my own self. It's also to share more about it with everyone watching because understanding there's more than one way to really check for breast health. So
Yes.
but so with that, what we're diving into. April, I would love if you would just share a little bit more about you and kind of what led you to this work.
So I got into thermography about 6 years ago because I was past the age actually where they want you to get your baseline mammogram, and I just had heard the downsides to mammography. So I just wanted to do some research on it to see if there was some alternative method of breast testing. And a friend of mine actually mentioned thermography, and so I did my research. I'm very into researching something just so I know it's effective, and was very impressed with the research and the efficacy of it. And I learned that it's not just for breast health, it's for total body health, and you can image very safely without radiation or compression. It was very non-invasive, and I loved that. So I had just gone back to school and became a health coach because nutrition, I was, found myself, my new passion was nutrition and healthy living. And in just about that same time, found thermography. So kind of incorporated it into my health coaching business. And now at this point, it's really all I do. And I have the health coach background is great. I can still, when people get their report back and it has different issues on it, I have that background to help them move forward, proactively and naturally to help heal their ailments.
I love that. And you have your own thermography center and you really are very passionate about this thermography. And I'm curious, like you mentioned in the beginning, that some of the things that we might not be aware of, some of the downsides to mammography. I'm wondering if you would be open to sharing more about that.
Yes. So, you don't want to bash any diagnostic tool really,
Right.
but mammography, it does produce ionizing radiation, which is accumulative in our bodies. And when we, get a dose of radiation, we don't detox that. It just builds up every year. And so that's a downside to mammography, and also the compression. So it's 50 pounds of pressure. And when you think about 50 pounds of pressure on your skin or any part of your body, but especially your fatty tissue breasts, you're crushing cells, you're crushing healthy cells. And if there's abnormal cells in there, or let's just say there is a tumor in there, you are risking rupturing that tumor that's encapsulated. And when that ruptures, cells spread. I mean, it takes one cell to come outside that tumor and, find its way through your body and metastasize somewhere else, right? So it's, there are risks, and there are risks with a lot of good things too, but, there are other ways to test the breasts that I feel are safer and without the radiation. And you can still, thermography is more of a physiological test. We're looking at blood flow patterns, and mammography is a structural test. So you're actually looking for structure, looking for the tumor. And we look for what happens when they're around the tumor, the blood flow. So, there are other options like ultrasound that is a structural test. So you can still get your structural test without the radiation and the compression.
I just think that's interesting to note. And like you said, there's benefits to everything. There's like pros and cons to everything, but just kind of being aware of what your options are. So if you do have healthy mammograms, then maybe doing, thermography is a great thing to add in so that you have this baseline. And then if something's off. If it needs further evaluation in any way, then you can go down that road too.
Yes, correct.
So, but I'm curious if you would share a little bit more. You mentioned thermography is really understanding the blood flow and this, that, and the other, but how does it work? Tell me more.
So there's a specialized camera that I use it stands in front of you. So it's really like a photo shoot kind of. It's kind of funny. I tell people they're there for their glamour shots. And it doesn't touch your body. It's several feet away from you. What it does is it captures the infrared radiation that is naturally coming off of our skin. So that infrared radiation is tracking your blood flow. It's where's the heat or where's the cool spots. So it turns that into a picture, a digital picture. And it's kind of like a fingerprint. They call it a thermal fingerprint. So everyone's a little bit different. But there are specific patterns with that, will indicate a pathology. There's specific patterns, and I'm just talking breast here. There's specific patterns maybe that will show more cystic or fibrocystic changes in your body. Lymphatic congestion. So those patterns are different. So I'm going to give you an example of in a mammogram, it's a structural test. So dense breast tissue looks like cancer. They have a very hard time distinguishing between dense breast tissue. And that's why so many younger women have to go back for either repeat mammograms, or they want them to go through, an ultrasound, and more than not, those are okay, right? Because it puts women through this emotional trauma. I mean, I've had friends do it, and something has come back negative and they have to go back or they go through the biopsy, but then the biopsy was negative, all through this whole hassle, and it's emotionally scarring for women. It's scary.
Yeah, for sure. I can relate to that. And I know, I think we were talking about this before we went on, is that I feel it's such a common thing.
Mm-hmm.
Breast cancer is becoming more and more pervasive. I mean, I know I've had 3 people recently in the past 2 weeks that have shared with me that they've just been diagnosed, or their mom, or, so I just think it's so important that it's not something we just think about once in the blue moon, but, all the time, ways we can be more proactive and just on our overall health, because yes, it's just a piece of the whole, but
Yeah.
I feel like it's a fun thing to focus on when we focus on our breast health. So for
Well,
not everyone, but I feel like it's a fun thing.
yeah, well, it is. It's very fascinating. I mean, breasts are, women have breasts, and they're used for many different things, and we should take care of them, especially with, how high the risk is now of breast cancer. But, going back to those thermal patterns, the reason thermography is so effective is because those thermal patterns for us, although we're all a little bit different, they should remain constant our entire life. So that's kind of what thermography is tracking. Is it constant, or is it changing? Is it changing? What kind of change is it? Because that particular change in your thermal pattern can indicate a new blood supply basically growing. And so the thermal patterns change around that tumor.
Yeah.
So that's how it works.
Okay, beautiful. And so if someone was interested in getting more or learning more about like thermography, where they could find someone, or going to your clinic, how does it work? How does the process work?
So, my website has a lot of information on it. My camera is through a Meditherm supplier. So Meditherm is the largest thermal imaging supplier in the world. It's global. It's rated one of the top, or the top camera actually, and that's the whole reason I chose Meditherm, because if I was going to do it, I was going to do it right.
Right.
And they're just very well established and well known throughout the world. But they have the ACCT, American College of Clinical Thermology, has a website that has a list of breast, they say breast clinics, but they'll do more than breast, obviously, but it's in there. So it's a list of clinics throughout the United States. And the beauty of that is, I've had patients who've moved to St. Louis and they went to another Meditherm clinic, or some of my patients who've moved away, I've given them the list of clinics elsewhere. And if you use the same company, the Meditherm company, we use the same interpreting doctors. So they're going to be able to compare to your last one. Whereas if you went to a if you start with a Meditherm clinic, you go to a non-Meditherm clinic, you kind of have to start over.
Right.
Because they always compare.
So they could kind of access what your past baselines were or have the same interpretations, basically.
Yes.
That's awesome to know.
Yes.
So then you could find your provider. And so then you go in, and what is the experience like? You mentioned the glamour shot, but just so people know what to expect if they would, want to move forward with this type of testing.
Sure. So I typically send my patients instructions, because there are some things you need to avoid just the day of your appointment. Nothing in diet except for caffeine. Caffeine can change your thermal pattern. So they'll want to avoid that. They'll want to just that day. And they'll want to avoid lotions, if deodorant, if they can. If they can't, that's pretty symmetrical. But any lotions, around that body. You don't want to exercise before you come in. You don't want to take a hot shower before you come in, or get acupuncture, physical therapy, anything like that. But they come in, and basically I have them change pretty quickly into their gown once they get in. And then we sit there for a few minutes and talk about health history. And because the doctors who interpret like to they assess your risk for breast cancer based on your history and your patterns. And so they always like a detailed health history when I send that in. And sitting there for, about 10 minutes, 15 minutes, depending on the history, how long it takes, that's helping their skin acclimate to the temperature of the room. So it's going to be a more accurate reading. Mm-hmm. So we talk about the history, and then after that I image. And, if we do just breast imaging, it's 5 images. We do a front one, we do 2 lateral or side views, and then we do 2 oblique views, kind of catty corner to the camera. So you're getting many different angles of each breast, and that's it. And, people who've never done it before, they've done mammograms their whole life, come in and just look at me and almost hug me.
Like, that's all.
This is awesome. Yeah. So it's a very quick, it doesn't take, even a full body is 28 images. You're not there 45 minutes and you're out of there. So it's very, very quick procedure.
And I'm curious, how often do you recommend they come in, or how often do you recommend this? Is it a yearly thing, or how kind of do you create the baseline?
So a baseline with thermography does take 2 separate appointments, about 3 months apart. Your blood cycles every 90 days. So they want you to come back after that cycle is complete. So beyond 90 days, we schedule a second breast appointment. And those 2 combined will complete a baseline. And then if everything is stable, just annual visits.
Yeah, beautiful.
That's all we need. Yeah. And go ahead.
No, you go ahead.
I was going to say, it catches things so early, because people wonder, well, should I come back? Maybe I should come back in 6 months. Well, you can come back in 6 months. It's safe, but it catches disease in such the early process of the disease that, it's okay. Annual visits are normally okay, unless they're high risk or have had breast cancer and are just keeping an eye and they just want to come every 3 to 6 months.
And I think one of the things that you're passionate about too is just the whole understanding that there's a lot of pieces to keep health in your breasts and beyond. And so I would love if you could share some more preventative tips, or what are some other things that women can do to be proactive in their health around
So
their breasts
one
specifically?
big thing that I see, and I've become more and more passionate because I see it all the time in thermography, is lymphatic congestion. Our lymph system is throughout our entire body, made up of nodes and vessels and all these different pathways to keep our fluid, flowing throughout the body. And so I see congestion on well over 50% of the reports that come back. So I did write an article about it that I share with my patients that has different tips that we can do. But, dry brushing is a great one. Rebounding, exercising in general, but rebounding specifically really helps, keep that lymphatic system moving. I refer a lot of my patients with severe congestion to a lady who does lymphatic massage. And we've had great results from that. When they come back and repeat their breast images, we've had great results from that. So that kind of gets things flowing, and then they can do the dry brushing or rebounding, use essential oils, that the things that they can do at home to keep it flowing. Not wearing bras all the time. I mean, I am one who I just take it off at night. But, after not too long ago, I read the study about wearing bras increases your risk of breast. There are studies that say that it doesn't affect it at all. But after what I see on thermography, I believe the ones that, the studies that say it does affect, because it constricts that lymphatic flow around our, we have major lymph nodes right under our arms and the side of our breasts, underneath our breasts, between our breasts. And so that's where our bras are. And so if we're constricting it, we're constricting that flow. So I am a huge believer now of, man, when you're home, set yourself free.
Right.
Take it off if you can.
It's
You
so
know?
true. I mean,
Yeah.
I think one of the things that I've learned too is that I do love lingerie and I love bras and I love a good underwire on occasion, but all the time is not healthy. And I think even if you have a bra you love, you can just literally clip the underwire out and you can pull it out. Or
Yeah.
just you can play around with wearing scarves. It's something that you can feel like you can, if you have, if you're, self-conscious about not wearing a bra, there's ways you can play around with it to be more comfortable. And it's not for everyone, but on occasion, just give it a try and see. And like you say, when
Yeah.
you're home, just be free. And I
Yeah.
love, even just like shaking your breasts when you just get that flowing a little bit, when you take your bra off, just
Absolutely.
get it moving.
I mean, just walking around without a bra, it like massages your breasts, and it just helps keep that lymphatic system going. So I think that's my biggest tip.
Hmm.
Make sure your lymphatic system is moving.
I love that. That's
Yeah.
great. And the rebounding too. We don't realize how much just movement in general helps so many things in our bodies. And
Yes.
is there anything else that you would recommend for proactive care?
Yeah. So, I see a lot of myofascial inflammation, and I'm learning about this right now. I go for myofascial release a lot with a physical therapist that has become a friend of mine, and through this, professional relationship. And she's not done it on my breasts, but I'm actually going to do a video with her next week where she's going to teach us how to do it on ourselves. She had an abnormal thermogram,
Hmm.
and because of that, started like basically testing it out and doing it herself, doing breast massage and myofascial release on herself. And it's easily teachable, she said. So I'm having her teach us on, a video, and I'm going to share that with my patients. But and I believe that that's going to be a really good thing for women to do, is just, again, a part of that's just the movement that's, you're giving your breast tissue on a regular basis. So I think that myofascial massage and release is going to be another big thing that I'm going to start doing as well. So that, and just a healthy diet and lifestyle is huge. I mean, that just alone, reduces our risk for any disease, but especially, for women, breast cancer.
Yeah, I love that. So those are great tips, because I do feel we are exposed to so many things on a regular basis, so many toxins and whatnot. So having alternatives to manage our health and to screen ourselves is just very important. I think I know for myself, I married a doctor, so he's kind of more of an alternative holistic doctor. So it's great because before him I just would blindly do whatever my doctor said to do. And I think learning, like anything, healthcare is a business, and it's so important to have your own knowledge around what's available and what treatment options are and what testing options are. And so I really just want to share what's out there, and people can do their own research and, to make their decisions about what's best for them. But I think many women don't even realize what's out there, what's available.
Right. Yeah,
So
I
I,
have a lot of women. I come across a lot of women who have never heard of thermography. It's becoming more mainstream, but it's really not mainstream yet.
yeah.
Widely used over in Europe, all over.
Mhm.
They ban mammography in several countries.
Right.
But, so it is used, it's been used for over 30 years. So it's nothing new, but, it's teaching, just getting the word out.
Yeah. So I'm grateful that you are able to share your wisdom around it. And I'm curious if there's any other tips or any other, important messages you'd like to share that you want to make sure the women listening can get today. And maybe even just more, just around embracing ourselves as we are, or whatever you feel, that the message you want them to know.
Gosh, such a loaded question, isn't
It
it?
really is. It
There's so
really is.
many things. I mean, part of loving yourself is taking care of yourself and doing your research and going with your gut. It may be your gut feeling may be different than a lot of people, but you have to go with the route, whether it's testing or whatever it may be. You need to go the route that you want to go, and where's your heart, where's your gut leading you. And I feel like part of loving yourself is just taking care of yourself like that. People don't realize that there's the 10-year protocol for the radiation with mammography is the same. Where is that statistic? I just had it. It's much radiation is standing 1 mile from the epicenter of the Hiroshima. It's 5 rad,
Wow.
the 10-year protocol. People don't realize that, and I think it's not that they're only listen to their doctor. I just think it's ignorance, and it's ignorance not because people want to be ignorant. What you don't know. And so that's why I'm kind of passionate about teaching people there are other ways you can do it, even if go half. If you still want to do mammograms, but just maybe go half as much as you are, with this other type of testing with it. Maybe you don't want to go every single year. You can, get half as much radiation as you would.
Right.
So I think it's just educating, being open to what your doctor says is not valid. I get it all the time. They say, why are you doing this thermography? Well, it is valid. There's research behind it, credible research behind it. And I think people need to know that it's okay. It's okay to question your doctor, and it's okay to do what you feel is right to do for you, because that's part of loving who you are.
Yeah. And I love how you say that, loving your body from the inside out is such a big part of this.
Yes, absolutely. I mean, if you don't feel good inside, you're not going to feel good outside. So it starts with early detection.
Yes. And I know you've got your website does have a ton of great information. I was learning so much just for my own self because I'm going to sign up for one of these, and I'm in Denver, so I'll ask you who you recommend in Denver. But
Send you a list of clinics out in that area.
beautiful. But it's midwestthermography.solutions.com if you want to learn more about it. And if you're in her area, you can definitely go visit her and work with her directly.
Yes.
And thank you so much again for being here and for sharing more about this important screening technology, as well as sharing your wisdom on keeping ourselves healthy.
You're welcome. Thanks for having me.
Yes. And for everyone listening, I am grateful to have you here. And I will be posting April's interview on our website as well. And if you have questions, please feel free to send them our way, and we will get back to you with the answers. And we will see you tomorrow. Thank you so much.
Thank you.